you would think that governments should be posting things like, guidelines for diets,
Yeah.
guidelines for exercise, but none of that is being done.
And see, this is for me. This is part of where I feel like Trump is failing
True.
because he should be doing this.
I agree with that.
Instead, he's trying to do this PR thing. So now Trump has been coming out and trying to do this PR thing and trying to make it seem like, well, I beat it very easily, and I understand what he's doing. He's trying to alleviate people's fears,
Hmm.
which could have some benefits.
But
But you have to be able to give
people
people the truth about how best to beat this thing.
and
You can't tell people, no, you can catch it and you recover from it. No. You have to tell people that you need to be healthy
in order to
in
beat
order to be able to
beat
beat this
whole
thing.
True.
And you need to promote that. And Trump is failing at that.
Absolutely
He's
true.
failing. After the election, Trump gets COVID. What was your first reaction? Toby, when I heard that shit, I think I was in bed with my wife. I was like, yeah, the Trump has COVID. Like, what are you talking about? I'm like, the president of the United States has
I mean,
COVID.
I mean, in a sense, I wasn't that shocked.
You weren't.
I wasn't really that
The
shocked.
president? The president that happens to be the most protected, probably the most protected person in the world,
But you,
this public figure that we know.
but you also shouldn't forget that like different figures in the White House have had COVID
They have.
since March.
They've been testing everyone every day in that White House.
No, but here is the second thing. Where did he catch COVID?
Has it been confirmed
Because some people claim that he caught COVID
at
with
the ACB announcement?
yeah, announcement.
When this was when they were announcing ACB's nomination.
Yes, but
But
even
then
she herself had
ACB
COVID.
had COVID.
Yeah,
I thought about that. I was
yeah, she
like,
had
what if
COVID.
ACB has been going around giving everyone COVID?
No, but she had COVID during the summer. So like by then she had officially
Oh, there's no way
recovered
she
from
could have.
yeah.
Okay.
So
So the speculation is that he got it from that White House garden event.
yes,
But has it been confirmed?
no, I doubt
It hasn't been confirmed.
Yeah,
And I doubt it'll ever be confirmed. But there were quite a few people that got it.
but some people are also saying that is it possible that he got COVID from
Hope Hicks.
no from the debate venue.
Here's the thing. Biden, okay, because they didn't test them at the debate venue, right? They said that they went on an honor system.
Hmm.
They said the reason why was because Trump himself showed up late.
Yes, absolutely true.
So the speculation is that Trump had already tested positive and just maybe wasn't showing symptoms yet.
And they purposely
And
arrived late.
and they were waiting for a second
Confirmation.
confirmation, and that was why they arrived late. That's the speculation,
Mhm.
not confirmed.
Mhm.
Again, there's all kinds of stuff that gets thrown out at the media that some of them sound reasonable, and then you hear to like weeks later that, oh no, that wasn't true. But then you never really whenever they never come back to like post retractions. They don't even bother doing that these days.
Doesn't work.
So a lot of time the lies usually get amplified. So I want to make it clear. I don't know if that was what happened, but this is all
But-
speculation.
But wait, one reason why, in a sense, I wasn't that shocked that I heard he got COVID was I said to myself that he's a president, so they'll probably give him the best treatment out there.
Yeah, they will. They will. What do you think of his handling of COVID and the fact that he isn't putting strict rules in the White House, and he's still having people walk around with or without masks optionally? What do you think about that? What do you think about his messaging so far on COVID?
Messaging to the whole country.
To the whole country, yes.
From what we've seen so far, there's definitely more that could be done in terms of messaging.
Okay.
There are guidelines he can put out there and suggestions he can put out there.
Mhm.
Um, I would also say that also like with the whole thing about like the White House and people walking around the White House without like any masks or
Yes,
anything, I feel they can do better than
they can do better than that.
yeah, they can do better than that. That isn't really controversial, but
Mhm.
also I hear again that literally everyone who comes to the White House
Gets tested.
they need to wait for 30 minutes to get tested. So like one thing I would say in general, and this isn't just only about like the response within the White House,
Yes,
but the general response in general is I do not exactly know how to grade his response.
it's hard
And
because
I'll tell you why there are lots of conflicting things out there.
okay,
Because on one hand, we're always been told that like things are a national disgrace,
mhm,
that 200,000 people have died from COVID.
mhm,
Trump tried to suppress the COVID news.
yes,
And on the other hand, there's a whole thing of where it's claimed that Dr. Anthony Fauci came out and was actually commending Trump's COVID response.
yes.
So, like, in a sense, I'll confess that I really do not
We
know
don't know.
how to
the
grade
the the
things.
COVID thing is a mystery.
And
Let's be honest.
yes, yes,
The
which is what I was
the,
going to come down to.
the truth is somewhere in the middle.
Which is actually what I was going
The
to come
truth is
down
somewhere
to.
in the middle, but we don't know. The COVID thing is being used
Mhm,
to an extent as is being amplified,
mhm.
right, for election purposes to a large extent.
True.
I'm not saying there aren't truths to how dangerous
True.
this disease are,
True.
but there's a lot of misinformation that's been
I
out
mean,
there. There's a lot of the way people present these 200K numbers.
mhm,
It's being politicized because let's be honest, right? These 200,000 people, the majority of them, and I'm not trying to downplay this thing,
mhm, mhm,
but
of
the
course.
majority of them were unhealthy people.
True.
And I think what this exposed was that America is a very unhealthy country.
Absolutely true.
It's a lot of fat. You know, there's a lot of
Fat,
you
fat
can't even
people
say
around.
fat these days. I'm scared to say fat now. Can you
Obese.
imagine? Ain't this some bullshit? I can't even say FAT these days.
Go
But
on.
health challenged people.
Mhm.
Majority of these people that died from it were old and had comorbidities. That's not to say they still didn't get killed by the COVID.
Yeah.
But the fact remains that they were
The underlying conditions made them
more susceptible
vulnerable.
to the COVID.
Mhm.
Even someone like Trump would have been kind of vulnerable because it said that he's in the media. They keep saying, you know, because he's clinically obese.
Now,
I don't think he's clinically obese.
let me
is
quickly
he?
drop something. Let me quickly drop something. You know, this guy,
Mhm.
Chris Christie, also got
He did.
and you know how obese Chris Christie is.
Yes.
Let me just say this, and please, I'm not denying that COVID is serious or
Yes.
anything like that.
If Chris Christie beats this thing,
The whole thing about COVID collapses in front of the public side because people will say that if a guy like who is as unhealthy as Chris Christie could beat
Mhm.
this, then
mhm,
why are we being locked up? Let me just drop that one out there.
yo, if Chris Christie beats this thing, this is gonna be that like people are gonna start taking another look at this stuff.
Yeah.
And but the reason why this is important, this is not for naught. It's a matter of yes, it's a national emergency. We understand it's a lot of people, too many people died, right? But then you also have to look at the other hand. And people think this is very inhumane when you bring this up.
And
But you have to look at the
one thing,
let me finish that. Let me
Okay.
finish. You have to look at the economy.
Mhm.
We have to. We can't act like it doesn't matter because if we slow things down, because those are the consequences, right? If we make all these federal mandates, if we hamper businesses from flourishing,
Mhm.
we slow things down
people
in
won't
a
have jobs.
in an effort to try to tackle this disease
Mhm.
that could have long-term consequences.
True. True.
Long-term economic consequences that
I
could
agree.
see far more deaths, that
True.
could see far more dysfunction. What's that?
My phone.
Oh, okay. I thought it was like an alarm upstairs.
No.
Far more dysfunction. So I think it's very, very important that yes, we need to treat this thing seriously. We understand 200,000 deaths, but we also have to understand that America is also a very, very unhealthy country. And
Absolutely
I think,
true.
and I think we need to do more as a country to get out the message. why health is important. We need to start placing more emphasis on diet, the things that we eat,
Exercise.
exercise. These are things that the media needs to focus on.
And I'll also add, during this whole COVID thing, someone posted something on Twitter like maybe the last week or the week before, and person was like, during COVID, he said to the effect of that during COVID, you would think that governments should be posting things like, guidelines for diets,
Yeah.
guidelines for exercise, but none of that is being done.
And see, this is for me. This is part of where I feel like Trump is failing
True.
because he should be doing this.
I agree with that.
Instead, he's trying to do this PR thing. So now Trump has been coming out and trying to do this PR thing and trying to make it seem like, well, I beat it very easily, and I understand what he's doing. He's trying to alleviate people's fears,
Mhm.
which could have some benefits,
But
but you have to be able to give people the truth about how best to beat this thing.
And
You can't tell people, no, you can catch it and you recover from it. No, you have to tell people that you need to be healthy
in order to
in order to be able to beat this
whole
thing.
True.
And you need to promote that. And Trump is failing at that.
Absolutely
He's
true.
failing.
Absolutely true.
And that's a problem.
Absolutely true.
And you have Biden on the other hand talking about he's trying to make all these federal mandates for this and that. And I'm just like,
One thing-
they've done this country so much of a disservice.
One thing I always said from the very beginning of COVID, and this is especially for Biden, what Biden could have been doing when COVID began was, while Trump was having his daily press briefings,
Mhm.
Biden should also have like his own daily press briefings. And who knows, maybe in those daily press briefings,
Mhm.
he can talk about things like exercise, he can talk about things like diets
Yes.
and healthy living. And let me just quickly pull back one step really quickly about this thing about obesity.
Yeah.
You know that like we always hear about how during this whole COVID crisis,
Yeah.
COVID has especially affected the Black and African American communities hardest.
Yes.
A key underlining factor, and I don't know how people will react to me saying this, is to be very truthful, the level of obesity in the Black community is kind of high.
Is it higher than the national average?
That I don't know, but still,
Because
it's
there are a lot
issue.
of obese white
Absolutely,
people too.
absolutely, absolutely.
I I I think
No,
that's a function.
no.
Now I'll
Okay.
push back against that,
No.
and here's why. I think that's a function of the
Their
fact that economic
two things I'll say.
realities.
Two things I'll say. I've always said that it's very simplistic to look at COVID just from one dimension. So yes, for example, the whole thing of obesity is there. You need to look at
Yeah.
economic variable.
Mhm.
You need to look at the variables of like the healthcare systems.
Yeah.
You know, to look
You
at the
need to look
variables
at cultures,
of
attitudes.
yeah. So there are many things at play, and I'll also add one other thing about COVID. Almost everyone, in a sense, has had a very simplistic narrative about COVID.
Mhm.
So, for example, some people say things like, COVID will finally show, why, healthcare must be, deregulated and things like that, which I'll confess I'm more on that side.
Really?
But
Deregulating healthcare?
no, in the sense that making it easier to develop drugs, making it easier to bring
Yes.
things like that.
Yes.
And then
But then
also,
but that doesn't help with access though. Because have you noticed that the more we deregulate healthcare, the
healthcare,
harder the access becomes.
healthcare isn't deregulated. That's another topic on its own.
Okay. All right. Another topic on its own.
Healthcare
But,
is not
but
deregulated.
go on.
And then you also have people on the other side saying things like, COVID will finally show why the United States needs universal healthcare.
Yeah.
The truth about the matter, and I'll be quite honest, and it goes back to what you were saying about the things about COVID which we do not know.
Yeah.
How
There's a lot of
how
blind spots.
COVID has unfolded doesn't exactly fit both narratives. So, like for example, if you look at countries like France and the UK, they have universal healthcare systems.
Yeah.
COVID has killed a ton of people and is decimating them.
It
Italy
is.
has the same. So And
Yes, that's true. That is true.
and basically, if anything,
That is true.
if anything, the people who actually have been able to actually deal with COVID well to some degree are the East Asian countries, Taiwan, South Korea, Japan.
But do you know what else they also have in common?
Yes,
They're healthy.
yes,
They have crazy healthier diets. Way
yes,
healthier.
yes, exactly,
Um,
exactly.
what do you think about the idea of herd, as well as Trump put it, herd mentality? Trump had said herd mentality, but you know what I mean,
Yeah.
herd immunity, the Sweden approach. Because I've always kind of been of that camp. That because when I looked at this whole COVID thing and I saw how messy it was, and I realized that wait, if we really have to wait before things get back to normal to
It'll be
get a
forever.
vaccine,
It'll be a long
ah,
time.
it's not sustainable, man. It's not.
What do
It's
I?
not. So my feeling has always been that I've liked the Sweden approach. Now I don't think America is necessarily there yet in terms of being able to adopt that same exact approach
Okay.
because like I said, America is very unhealthy.
Mm-hmm.
We don't quite have the discipline
Mm-hmm.
to be able to do that. You know, in
Absolutely
Sweden,
true.
they're still doing social distancing. In America, you still have people fighting
Yeah.
to wear the mask when they're in close corners. Like
Mhm.
Americans, they look kind of crazy.
True.
Let's be
True.
honest. We the way we look, the way we embrace this our freedom, man. It's sometimes it's to our detriment sometimes. But I
True.
get it. I get it.
Mhm.
There are certain things that are unique to America that may not make us be able to adopt that Sweden approach. But I think we should definitely be going towards
Mhm.
that solution.
Mhm.
Towards some level of okay, we kind of need to let this thing
Here,
kind of burn through our population to an extent.
here is
I think we do.
here is the main thing about students' herd immunity. To be very truthful, I do not at this point even know what to say. And the fact that I do not know what to say, in a sense, kind of shows how politicized COVID has become.
Yeah, because we don't really
Because
have the information.
because there are because I've seen articles of people who fanatically say that herd immunity has been a disaster in Sweden. Sweden unleashed a disaster, and I've also seen articles saying that herd immunity has been a success.
Yeah, you hear different things.
So I mean, I don't know, but what I would also say is in this country, maybe you can look at South Dakota, for example.
Yeah,
I know like they are more of like a sparsely populated state.
yeah,
They're more sparsely populated than everyone else. But basically, they didn't do any lockdowns or any of the other things the other states did,
yeah.
and they seem to be doing relatively well up to an extent.
Well,